Hello, everyone, and welcome to our Stress and Infertility What is the Connection event. My name is Monica Pereira, and I am the marketing specialist at Inception. Before we get started, a quick review of our Zoom platform. You can ask the Ask a Question box to type any of questions that you may have throughout the event, and we'll answer them at the end for the Q&A portion. We will also have a poll at the end once we get started with the Q&A. So please go ahead and answer that as we do look at that for feedback. And with that being said, I want to introduce our wonderful speaker for tonight. We have our renowned fertility psychologist and Inception's Chief Compassion Officer, Dr. Alice Domar.
Thank you so much, Monica. Hi, good night, everybody. Good evening, everybody. I have so many slides, and I know I can talk really fast because I'm from Boston, but I think I'd just as soon get started right away with the slides. And I will try to speak fast enough that I will have time for questions at the end. Because as everybody knows, I really like questions. And I believe everyone's going to get the slide deck sent to them tomorrow. Is that right, Monica? They get all the slides. They get all the slides tomorrow.
I can double check to see if that is a function on Zoom to where I can attach it. Yes.
Okay, well, whatever. I'll just talk really fast, and I hope to take lots of questions at the end. So could I have the next slide, please? So, basically what I want to talk about tonight, I mean, this is a field that I've been researching for the past 38 years. I know I'm old. And I want to talk about the psychological impact of infertility in terms of what's a normal emotional reaction to this crisis. I want to talk about the impact of infertility in one's life. I want to talk a little bit about whether or not stress can impact fertility, and then end with different methods to decrease stress. I mean, as I said, I've been doing research on this and seeing patients in this field for a very long time. And so, I've learned the hard way what works and what doesn't work. Next slide, please. So most women and men who are going through infertility report feelings of anxiety, and most women also report symptoms of depression. So the majority of women and men feel anxiety, the majority of women report depression, and I think about 35% of men also report symptoms of depression. So this is a very, very common reaction to going through infertility, and I'll talk about why in a bit. But if you are feeling anxious or depressed, it means you're normal. And if you're not feeling anxious or depressed, it also means you're normal. Being anxious or depressed is not pleasant, so I'm going to talk about ways to reduce those symptoms. Next slide, please. So other common feelings are just feeling really lonely. I was actually talking to a reporter today about how isolating infertility is, where you feel like you're just sort of surrounded by the fertile world and you can't pick up a People magazine or go on social media without seeing, 14,000 people getting pregnant easily. And so it's normal to feel lonely. It's normal to feel isolated. I'll talk about jealousy in a bit. A lot of people feel really angry, either at their bodies, at their partner's bodies, at their physician, at their friends, at everyone who gets pregnant. And the whole experience can just be really frustrating because people going through this wanted a baby yesterday. And the last thing they want to do is have to go through treatment. Next slide, please. So it's very, very common for women, more than men, who are going through infertility to find the pregnancies of other people to be really hard. And, I am seeing a patient right now who gets pregnant easily and has had several miscarriages. And so when I first started seeing her, I don't think she really thought of herself as being an infertility patient because she got pregnant easily. She just kept on having miscarriages. And at that point, she wasn't bothered by other people getting pregnant because she could get pregnant. And now as she's come into the world of infertility treatment, she's now finding other people's pregnancies to be really hard. And she, first started to decrease how much social media she was looking at. And I said, maybe you should stop looking at social media. But it's really normal. I mean, I'm a psychologist, and I can say that this feeling that you want to avoid pregnancy announcements and or pregnant women is almost like a phobia, but it's not an abnormal phobia. It's a very normal phobia. It's just really normal if you're going through this to want to avoid, baby showers and first birthday parties and brisses and baptisms and, gender reveals and not wanting to go to the obstetrical unit to visit new moms. And some men feel this way too, but they don't tend to feel it as intensively as women do in my experience. Next slide, please. So I did a study many years ago that showed that women with infertility had the same level of anxiety and depression as did women with cancer, HIV positive status, or heart disease. And this is one of these like, whoa studies where I was like, yeah, duh, I'd been working with infertility patients for years. I knew how incredibly challenging it could be. But this was like a big wake up call for other people because it really showed how intense the emotional impact of infertility can be. And I've actually had a lot of patients ask for copies of this study to give to their mother-in-law or their boss or somebody just to say, look, I'm having a really hard time coping, and so is everybody else. And this is very normal. Next slide, please. So in the spring of 2020, when COVID hit, and COVID hit Boston, which is where I live, very, very hard because there had been a conference led by Biogen, I think it was Biogen, in a hotel in Boston, I think at the first week of March of 2020, maybe. And there was one of the scientists was from China, and they were all in one room together for a couple of days. And literally everybody in that room came down with COVID. And the epidemiologist later traced and found that 300 cases of COVID came from that one meeting. So because there were so many cases of COVID in Boston, all the infertility centers were shut down by the Board of Health. And so we thought, here's a good chance to see if I'm right and everybody else is wrong, in that I predicted that our patients would still say that infertility was harder than COVID, and everybody else was like, yeah, nothing's harder than COVID. And I was right that our patients really did say that COVID was just really harder, and it was harder for them than even COVID-19. So that's the impact of infertility on people. So if you're feeling anxious or depressed, as I said before, it simply means you're normal. It doesn't mean it's okay to feel that way. And I know it's really hard to feel that way, but if your partner doesn't understand your distress level, or your family doesn't understand your stress level, or your friends or your coworkers or whatever, I understand it because it's a normal reaction to this particular crisis. Next slide, please. So the World Health Organization has classified infertility as a disease. It is a disease. It's a disease that affects women. It's a disease that affects men. It's a disease that affects both of them. And despite the fact that the World Health Organization classifies infertility as a disease, people still blame usually the woman for their infertility, despite the fact that almost half of all cases are male factor. And so I'm going to guess that every single one of my patients and everybody who's ever gone to one of the Braley clinics has probably heard, just relax and you'll get pregnant, or you're working too hard, or you're too fat, or you're too thin, or you weren't eating the right foods, or you're exercising too much or not enough. And all these things are a blame the victim mentality. And that's not fair. You don't blame somebody for getting cancer. You don't blame someone for getting heart disease. You don't blame someone for getting kidney disease. So why is it okay to say to somebody with infertility, just relax and you'll get pregnant? I mean, you'd never say to a cancer patient, oh, just relax, your cancer will go away. It just isn't okay. Next slide, please. So infertility can have a big impact on every area of your life. And I think it's rather unique compared to most other diseases in that it does impact pretty much every area of your life. So if you're in a let's say a heterosexual relationship, and I was saying this to the reporter today as well, I have never in my career seen a heterosexual couple where the man and the woman reacted to infertility in the same way at the same time. Often women are sort of ahead of the guys, in that they think there's a problem sooner, they want to see a doctor sooner, they want to start treatment sooner, they want to do IVF sooner. And so when you sit down with the couple, the wife will say, he's holding me back, he's keeping me from having a baby. And the husband will say, or the male partner will say, she's pushing me to make decisions I'm not ready to make. And so that can cause some distress. Women also tend to, and I'm not being sexist here, I'm a woman, women tend to want to talk about it more, and men tend to focus more on problem solving. And so, when I work with a couple who are complaining about this, there are all these different exercises you can do so that women feel heard and men don't feel their entire life is talking about infertility. Um, and it's hard because for a lot of couples, this is the first crisis they've experienced together. And it's really scary that your first crisis, that the person you love isn't coping the same way you are or isn't reacting the same way you are. But as I said, I've never seen two people cope or react in the same way at the same time. Next slide, please. So it can also have a big impact on your sex life because a lot of people, you try and try and try, and every month you try to have sex mid-cycle. And so you begin to associate sex with failure. And it can feel challenging to feel intimate and spontaneous. And it sort of goes from love making to baby making or trying to make a baby. And, a lot of women only want to have sex mid-cycle. And I've actually had patients say to their partner, well, like it's day 7, why should we have sex? And the partner's like, because we love each other and because it feels good and because, it's a good thing to do together. Next slide, please. So it can also have a really big impact on your family. And if you have siblings who get pregnant, especially if they're younger siblings and they're producing the first grandchild, that can feel really hard. Your parents or siblings or aunts or uncles or grandparents or whatever might say things that are insensitive. If I had a nickel for every parent or grandparent or sibling who said something stupid, I'd be very wealthy. I think a lot of people are ignorant. I think a lot of people, read from different sites where they may get inaccurate information. In terms of siblings, honestly, sibling rivalry never dies. And so your younger sibling might be kind of secretly proud that they produced the first grandchild. And, if you are an only child, if you're the oldest child, whatever, your parents might be pressuring you to produce grandchildren quickly, especially if they're older parents. So you can love your family and love everybody in your family, but that doesn't mean they're going to get it. And it doesn't mean that they say the right thing. They may not say the right thing at all. Next slide, please. It can also have a negative impact on your friends or on your relationship with your friends, because if they're having kids, you probably feel left out. When people get pregnant and have kids, that tends to be all they talk about. And so if you get together with a group of friends, all they might talk about is pregnancy or babies. They may not they may not know what to say to you or do. They don't know how to support you. If they haven't been through infertility, maybe they don't know what you need, and maybe you need to tell them what you need. Next slide, please. Obviously, infertility can impact your job or your career because, you have to go to the clinic for tests during the day. Monitoring might mean you're late for work. You can't travel for work if you're undergoing treatment. A lot of jobs involve contact with pregnant women or babies or small children. I've had patients who are obstetricians or nurse midwives or labor and delivery room nurses. They can't get away from it. And if you work, especially in one of those cubicle situations, you can't avoid pregnant coworkers. And as I said, a lot of people going through infertility have a really hard time being around pregnant people. And if you're in a cubicle and your next door neighbor is pregnant, that's all you're going to hear about. So that can be really, really challenging. Next slide, please. It can also impact your religious or spiritual beliefs, because a lot of my patients have said that it's the first time that their God hasn't answered their prayers. And a lot of people wonder if their infertility is a punishment from God for doing something wrong in the past, like, drinking or premarital sex or something like that. And, we're also seeing a lot more people feel very conflicted if their religion, for example, prohibits IVF and their doctor is telling them their only chance of pregnancy is IVF. So what do you do? And next slide, please. And finally, it can impact your body image or your self-esteem. I was trying to explain this to someone today, that people identify being feminine or masculine, and that includes being fertile. And so, to be a woman means you can have a baby, and to be a man means you can get your partner pregnant. A lot of infertility treatments involve weight gain. And, yes, the weight can come off afterwards, but sometimes it's hard to lose weight if you're on medications every other month. And, it can just feel really hard sometimes. That comes so easily to other people is a struggle for you. And I have this giant pet peeve, and I don't understand why people need to do it. And they'll say, just especially to my patients, oh, I don't even know how we got pregnant. Well, I can tell you how you got pregnant. Or we only tried once. Like, I don't need to know how many times you had sex. Why do people need to share how long or how easily or what position or whatever it is it took them to get pregnant? It's no one's business. And for someone going through infertility, it can be really hard. Next slide, please. So the question that I've kind of been researching for my entire career is stress and infertility, what comes first? So I think everyone believes that infertility causes stress. And a lot of people believe that stress causes infertility. Even in the Bible, literally, there was a story of Hannah, and there was a strong implication that she was depressed, she was infertile, and then once she became less depressed, she immediately got pregnant. So this has been going on for a long time. And to be very honest, and I'll put my bias right out there, I do believe that stress can decrease fertility in some people. Next slide, please. So there have been a number of studies which indicate that stress can lower fertility in both men and women. I mean, pretty much every animal study or every examination of animal reproductive behavior has shown that no matter what the species, if you stress out either one, the male or the female, or both, fertility comes down. And if it's true of monkeys and elephants and mice and whoever you study, and pretty much every species on the planet, why would we think that wouldn't be true of humans? We're not that different. So the question then is, and I've argued this with a lot of people, if we show that people who are stressed have lower fertility, is it literally the impact of stress on the reproductive system, or is it other behaviors which can lower fertility? Because if you're stressed or depressed, you may not want to have sex as often, and that does interfere with conception. You might drink more alcohol and or caffeine. We know that decreases fertility. Same with smoking cigarettes. Same with eating less healthy food. Same with sleeping poorly. And so, it's really hard to tease out whether it's the impact of stress on the reproductive system or if it's the lifestyle behaviors that change when somebody is stressed as they go through infertility. And I'm actually doing a study right now. We have some results, but I can't share them yet, which is actually looking at the impact of physiological manifestations of stress, like your heart and your brain, and whether or not that impacts IVF outcome. Next slide, please. So there have been a number of studies that indicate that the more stressed the woman is before and during an IVF cycle, for example, the less likely she is to get pregnant. And that women who are less stressed are more likely to get pregnant. Next slide, please. There've also been a lot of studies, and this is something that interests a lot of people, is that the more distressed or depressed a woman is before and during her first IVF cycle, the more likely she is to drop out of treatment even after only one cycle. And by the time someone gets to IVF, after trying on their own for a while and maybe trying initial treatment and then moving on to IVF, getting pregnant on their own, i.e. if they drop out of treatment, is pretty unlikely. And so I've been trying for many years to figure out how can we decrease the stress of treatment so that people feel that they can cope relatively well by cycling until they get pregnant. Next slide, please. So what about the impact of psychological interventions? If you go through a mind-body group or a support group, or you go into counseling individually as a couple, are you more likely to get pregnant? And there have been, tens and tens and tens of studies that have looked at women, randomized controlled trials. Women are randomized to either go through some kind of psychological intervention or be in a control group where they just get routine care. And almost all these studies have shown that women who participate in whatever these interventions are report feeling less depressed, less anxious, less angry, less isolated. It's obvious that being with other women who are going through infertility is a good thing because you do feel less alone. You do feel more normal. Next slide, please. So most of the research, and I can say pretty definitively, almost all the research in the last 5 or 6 years has shown that women who do some kind of psychological intervention, and specifically group interventions of more than 6 sessions where they learn coping skills, also have much higher pregnancy rates. And I've done 3 or 4 intervention studies, usually with a mind body group. And we have found that women who are randomized to the mind body group have double or triple the pregnancy rates of women who were randomized to the control group. So the assumption I've made is if a psychological intervention significantly increases the chances of one getting pregnant, then you have to believe there is some facet of stress, some aspect of stress that is impacting one's ability to get pregnant, even with IVF patients. Next slide, please. So to sort of summarize what I've said up till now is women and men experiencing infertility report high levels of anxiety and depression. And it's really yucky to feel anxious and or depressed. It's just, I mean, infertility is hard enough, but it's even harder to then deal with all these really tough emotions. These high levels of distress might make treatment less effective. It probably does increase the need to drop out of treatment. Counseling, usually in a group format, is associated with significant decreases in anxiety, depression, anger, irritability, etc. And most of the research, as I said, in the last 5 or 6 years, have shown that women who are randomized to do some kind of intervention are much more likely to get pregnant than women who are randomized to the control group. Next slide, please. So how can you reduce stress? You know, I could sit here all day and talk about how stressful it is to go through infertility. But let's talk about how to reduce the stress. And so I break up these how to reduce stress into 2 different categories: the physical approaches, which include many relaxation techniques, appropriate nutrition, and moderate exercise. Next slide. So these are mini relaxations. They're basically based upon diaphragmatic breathing. And the diaphragm is actually this huge muscle which separates the chest and abdominal cavity. And when we get tense or anxious or upset, we tend to sort of unconsciously tighten our abdominal muscles, which restricts the ability for the diaphragm to drop down. So you can't take a normal breath. You don't get as good oxygen exchange. But when you relax or you focus on diaphragmatic breathing, it allows for deeper breathing, which gives you a chance to have a much better oxygen exchange. It decreases your blood pressure and heart rate and increases your sense of relaxation. So it's to everyone's advantage to do these mini relaxations, both when you're stressed and ideally before you think you're going to get stressed. Next slide, please. So, you know, this is the first mini, and I'm not going to spend a lot of time doing them because I know I really want to leave time for questions. But basically, you know, when you do a mini, if you feel comfortable and you're not driving, you can close your eyes and just take a couple of nice, slow, deep breaths. And the first time you take a breath, say the word 10 to yourself and then exhale. When you take the next breath, you say the word 9 to yourself and then exhale. And you continue until you get down to 0 and then slowly open your eyes. And if you feel better, go about your day. If you don't feel better, try it again and do this several times. Next slide, please. For the second mini, and this is actually what I do when I can't sleep, as you inhale, count very slowly from 1 to 4. So as you breathe in, you go 1, 2, 3, 4. And as you exhale, you go 4, 3, 2, 1. And do this at least 3 times. And again, if you feel better, go about your day. And if you don't feel better, try it a couple more times. And I believe I have a third mini. Do I have a third mini? I can't remember. Next slide. Yeah. So the third mini is just a really easy one to do, is take a slow, deep breath in, hold it for a count of about 3, exhale, hold it for a count of 3, and try this for at least 3 times and see if that helps bring down your stress level. Next slide, please. So when should you do a mini? There are 2 different times to do a mini, as I said. When you're aware you're anxious. So while you're driving, while you're sitting in the clinic waiting for an appointment, before you go to the bathroom for the last, week of your cycle, if you're waiting to have an injection, do a mini ahead of time. When you know you're anxious, do a mini. The second time to do a mini is to start identifying situations which push your button. And so if you're an anxious driver, do a mini before you turn on the ignition. If you don't like, I actually used to have this horrendous commute when I was working in Boston, and I live like 25 miles out of Boston. And so I would condition myself that if I saw a red light, I would automatically start doing slow, deep breaths. I did have my eyes open. They're great to do before and during injections. They're great to do before and during ultrasounds. They're great to do before and during blood tests because they bring down your level of anxiety. And, if you need to call the clinic for test results, or but you need to look on your phone for test results, do them any ahead of time. And, if you're still on social media and it tends to make you anxious, do some minis before you check your social media accounts. Next slide, please. So relaxation techniques, there are thousands of relaxation techniques, and there are very few things that bug me more than a patient telling me she went and saw a therapist who told her that she had to learn to meditate or she needed to learn yoga or whatever. The fact is, there are so many different relaxation techniques, and I can't tell you which one is going to work for you. So what I do with my patients is I teach them about 10 different techniques, like meditation or progressive muscle relaxation or whatever, until we find one that actually works for that patient. And some of these apps, like I got all of Inception Prelude to get the Calm app, because they have hundreds and hundreds of different guided relaxations. And if you listen to enough of them, you're going to find which ones you really like, which ones work for you. It's the same thing for anybody. So if you've tried relaxation in the past and you've only tried one or two different strategies, try some more, because I can guarantee you there is going to be one that works for you. Next slide, please. So there's two very significant benefits from practicing a relaxation on a regular basis. One is when you do a relaxation for like 10 or 20 minutes, you're probably going to feel more relaxed and less anxious during and immediately afterwards. I mean, it makes sense. You do a relaxation technique, you're going to feel more relaxed. But after a couple weeks, if you can get yourself to do this on a regular basis, you'll experience what's actually called the carryover effect, which means, if you're like me and when you're stressed, you can't sleep, once you start doing relaxation techniques, after a few weeks, you're going to find you're sleeping better, or you aren't getting as many headaches, or you don't have as many stomach aches. So however your body, your mind tell you they're stressed by any of headaches, neck pain, back pain, etc., after a few weeks of doing a relaxation technique, you'll actually experience this. You're going to start seeing those symptoms go away or certainly get less frequent. Next slide, please. So, as I said, symptoms of this carryover effect include, sleeping better. I have a lot of patients who come to see me for migraines, and usually within a few weeks, their migraines either go away or they're just less intense. They have a lot of fewer GI issues. PMS gets better. They can have less shortness of breath, fewer palpitations, sort of you name it. Any symptom that's made worse by stress can be made better by doing a relaxation technique. Next slide, please. But as I said before, it's really important that you pick a technique or several techniques that work for you. I mean, I can meditate sometimes. I really don't like yoga. I really like progressive muscle relaxation. There are a lot of different relaxation techniques I like, but I don't like all of them. And so it's very personal, and you need to try out different ones until you find one that works for you. Next slide, please. So nutrition, this is like a huge, mine, like a landmine in terms of infertility, because on a daily basis, I get asked, what's the infertility diet, or what should I eat that makes me pregnant, or what shouldn't I eat that doesn't make me pregnant? Honestly, when it comes to infertility or infertility, in terms of food, there's no really bad or good food. There's no magic diet. The goal is to actually eat the way your grandmother told you to eat, which means lots of fruits and vegetables, lean meats, whole grains, nuts, fishes, olive oil. You know what you're supposed to eat. I have to say, though, that as much as the nutrition per se, there's no, infertility diet, being a normal weight is really important. So if you're too thin, if you're obese, whether you're a man or a woman, that very likely is going to be associated with lower fertility. The good news is that in someone who's underweight, gaining like 6, 7, 8, 9 pounds can often sort of bump you into the fertile range. And if you're overweight, losing 10 to 14 pounds can also bump you into the fertile range. So we're not talking about massive changes in weight, and this can be very temporary. If you like being really thin and you don't like the idea of gaining weight, just gain weight until you finish building your family. Same thing if you're obese, lose weight until you finish building your family, and then you can just be the weight that you want to be. Next slide, please. So what I tell my patients is I recommend that you eat in what's called an 80-20 fashion. So if 80% of what you eat is the stuff your grandmother told you to eat, the 20% can be what you want. There is a well-known issue, and this is on the next slide, where let's just say you're being really good. And for breakfast, you have your, non-fat, Greek yogurt with berries. And for lunch, you have a garden salad with some, salmon on the top and dressing on the side. And you've been really good all day. And then you're at work and someone brings in cookies or brownies or cupcakes or a birthday cake or whatever it is. And you have a piece of cake or a cookie or whatever. When you get home, you're much more likely to have fettuccine Alfredo and Haagen-Dazs because it's actually called, next slide, please. It's called the what the hell effect. So if you've been watching what you eat, and most of us have some sense of that, once you've been bad or broken your diet or whatever it else, it's like, oh, what the hell? I just had a cupcake. I might as well have fettuccine Alfredo for dinner. And that, what people do is they don't eat anything sweet or salty for 4 days, and then they eat a bag of chips or a bag of cookies. And it's much better for you to have a couple of cookies every day, which is your 20%, or a handful of chips every day, which is your 20%, rather than, going without for a few days and then going crazy. Next slide, please. So exercise, this has been a very hot topic for a very, very long time in this field. And I think right now everyone has agreed that moderate exercise is associated with the highest rates of fertility. Honestly, as a psychologist, when I talk to non-infertility patients, exercise is my first suggestion for stress relief because it really is the best stress reducer there is. Honestly, if you're trying to get pregnant, walking is the best thing. Literally, I used to keep a pair of sneakers in my office when I saw patients in my office. And if they weren't exercising, I'd say, we're going to go for a walk. And my patients and I would take a walk for walking therapy so they could see how much better they felt after walking. The goal for really good health and maximal fertility is to exercise for about half an hour, 4 to 5 days a week. Couch potatoes are not associated with fertility, and there is some data to show that very vigorous exercise like running, aerobics classes, hot yoga, things like that might actually be associated with reduced fertility. Next slide, please. So to summarize the physical approaches, do minis when you feel anxious and before situations that that make you feel anxious. Try to start a regular relaxation practice, ideally 15 or 20 minutes a day, once or twice a day. Follow the 80-20 eating plan. So, you can have a cupcake and that's just your 20%. And try to begin and maintain a regular, habit of moderate exercise. It makes it easier if you have a buddy, like a walking buddy. I used to have a walking buddy, and we had a rule that if it was over 15 degrees and not raining, we would walk every day. And it was great for me because she gave me the structure and the discipline of actually walking every day. Next slide, please. So let's talk about the brain. How can you reduce stress from a more of a what we call cognitive or emotional approach? And there are basically 5 ways to reduce stress. One is to challenge automatic negative thought patterns. One is to get social support. A third is healthy ways to express your emotions. Then there's self-nurturance. And finally, how to battle perfectionism. Next slide, please. So challenging automatic thought patterns is this whole field of psychology called cognitive behavior therapy. It's the kind of therapy I practice. And pretty much every patient that I've ever seen has had these negative thoughts that play over and over in their head. Things like, I'll never have a baby, the infertility is all my fault, my partner's going to leave me for someone fertile, I'm being punished for doing something wrong. And these are all recurrent negative thought patterns. And I don't know if any feel familiar to you, but these tend to be the most common that I've heard. Next slide, please. So almost all the thoughts that play over and over in our head are wrong. If you actually look at 100 of your thoughts, probably 90% are negative because we just don't think great things about ourselves, but 90% of those are wrong. And they tend to stem from things people have said to us in the past, or it's our fear being expressed. So there's a method called cognitive restructuring, which challenges these automatic negative thought patterns. Next slide, please. So when a patient tells me their negative thought, like, I'll never have a baby, I ask these 4 questions. Does this thought contribute to your stress? Where did you learn this thought? Is this thought logical? And is this thought true? Next slide, please. So for example, as I said, most of my patients have at one point had a thought, I'll never have a baby. So I'll say, does it contribute to your stress? And the answer is always yes. And I'll say, where did you learn this thought? And she might say, I don't know. My doctor has never told me I'll never have a baby. So I guess I'm just afraid I'll never have a baby. So is it logical to say I'll never have a baby? The patient might say, well, if I knew I would never have a baby, I'd stop trying so hard. I wouldn't be putting myself through all this. So is the thought true? No. If you knew you'd never have a baby, you'd do other things in your life. So perhaps a restructured thought could be, I'm doing everything possible to get pregnant. And that's a logical thought, and it's a true thought. And it's a lot better for you to be thinking that as these things that play over and over in your head rather than, I'll never have a baby. Next slide, please. So as I said before, socially, infertility is so isolating. You really feel that everybody you know is getting pregnant very easily. First time, don't know how it happened. When I first got into the field, 1 in 8 people of childbearing age were going through infertility. It's now 1 in 6. And I actually just read a report that in China, it's 1 in 4. So that's how common infertility is. So it's very likely that you know people who are either going through it or have been through it. And you're not the only person. If it's 1 in 6, think how many people you know. People have been through it. It's so amazing to me that, when I talk to friends or family members and, I'll say, oh, it's interesting that, you and your sibling are 5 years apart. And they'll say, oh, yeah, my parents went through infertility, or my mom had 4 miscarriages, or whatever. It happens to a lot of people. And if you feel okay doing it, mention what you're going through to a few people that you trust. And either they will say they had personal experience or they know somebody who does. You are so not alone. But talking to other people who have been through it or who are going through it can be really helpful. Next slide, please. So lots of healthy ways to express emotions. I mean, there's so many negative emotions that I've mentioned: anger, jealousy, frustration, shame, guilt, you name it. My patients have told me about it. And one of the healthiest ways to decrease these feelings is to write about them. And there's a psychologist actually from Texas named James Pennebaker, who's done this really cool research on how to sort of process and get rid of these negative emotions. And so his research has shown if you can write for 20 minutes a day for 4 days, it really lifts a lot of weight from you. So if you're looking for new ways to help you deal with the negative emotions associated with infertility, try writing for 4 days and see what happens. Next slide, please. So self-nurturance, this is something I actually wrote a book on this because I've seen so many women in my career who feel really uncomfortable doing nice things for themselves or treating themselves as well as they treat other people in their lives. Because when I say to a woman, why don't you buy yourself a sweater, or why don't you take a day for yourself? They're like, oh, I can't be selfish. And there's a difference between being selfish and self-nurturing. So being selfish means doing things for yourself at the expense of other people. Self-nurturing means doing things for yourself in conjunction with the needs of others. And we all have to do this because the way our society works right now, there are not a lot of other people caring for you. And so you need to learn to care for yourself and not feel guilty about it. It's really important. It's crucial for our mental and physical health. Next slide, please. So one thing that I suggest that my patients do is take a piece of paper and quickly write down 20 things in your life which bring you joy. And then ask yourself, how many of these things do you do on a daily basis? And so, for example, I personally really love dark chocolate. And so every day I'll have 1 or 2 pieces of dark chocolate. That's my 20%. But it's something that brings me joy. I also really like flowers. I love flowers that smell good. So maybe on a Monday, I'll buy myself, either a hyacinth or a lily or something that smells good. It's going to cost me a couple dollars. But every time I smell it, it makes me feel good. And there are little things you can do on a daily basis just to bring a little bit of happiness and self-nurturance into your life. Next slide, please. So perfectionism, big deal. I also wrote a book on this because it's been an issue I've dealt with in my life. There's nothing wrong with with wanting to be a really good daughter, wife, friend, employee, family member, a good housekeeper, whatever it is that's your passion. There's nothing wrong with wanting to be good. Next slide, please. But when you want or need to be perfect in everything you do, it's going to lead to anxiety and a constant sense of dissatisfaction. No one can be perfect in every area of their lives. And what you need to do is to think about the area of your life where you want or need to excel. And for the areas of your life you don't care that much about, just be good enough. So, for example, like I really care about my job and I care about my family. I don't care so much about how my home looks. I know that there are a lot of people who think that's really awful. I remember when we painted one of our family room. I think it took us 7 years to rehang the pictures, and we only rehung the pictures because someone I cared about was coming over. But I need to be really good at certain things. I don't need to be perfect in every area. And I think all of us need to think about that. Which are the areas you care about, and which are the areas that you can be good enough? Next slide, please. So, for example, because I live in Boston and work in Houston, I fly a lot. And every time I get in an airplane, I need my airline pilot to be a perfectionist in terms of being a pilot. But I really don't care if that pilot's a good tennis player. We want, if we go out to dinner, we want the chef to be really a perfectionist in the kitchen. But we don't care if they don't make their bed, et cetera, et cetera, et cetera. So the same thing applies to you. Allow yourself to push yourself in the areas you really care about, but not in every area. You got to let some go. Next slide, please. So in summary, what are sort of psychological ways that you can relieve stress? You can challenge these automatic negative thought patterns and restructure them to be logical and true. Get some social support, go to the resolve.org website and join a support group. Seek out others you trust to confide about your infertility. We are actually launching in September a new yoga program, which is going to have a lot of group support in it for our patients. It's going to give our patients a chance to be with other women who are going through this. Keep a journal and express your negative emotions or struggles. Write for, 20 minutes a day and see how it feels. Nurture yourself without guilt, and try to battle your own perfectionistic tendencies. Next slide, please.
That's our last slide.
That's the last slide. Okay, now my favorite part. I would be very, very happy to take questions.
Okay, so
And I don't know how to do it. So Monica, you're gonna have to tell people how to pose questions.
yes, so at the bottom we do have an icon with 2 little bubbles that says Q&A. So please go ahead and enter any questions you may have there. We also have our resources. So Dr. Omar did mention Resolve. So we do have in the resources tab a couple of resources, links to Resolve, ASRM, and our fertility studies, and a couple of other good websites there. And I will also launch the poll here while people start sending in their questions. And let's see. So how can individuals differentiate between normal stress and stress that may be negative and negatively, affect infertility?
Well, it's actually a really good question because people always assume stress is bad. And in fact, oh gosh, maybe 50 years ago, a scale came out called the Holmes and Race scale, which actually ranked stress as it impacts you. And again, we all think of stress as bad. And so in fact, some of the top ones are death of a spouse, divorce, stuff like that. But there are also some things there that we consider good, like getting married and buying a house and getting promoted. And so I don't think most people think that stress can be good. But the fact is, anything that requires us to adjust or change can cause stress. And so I would say for most people, we all want to be a little bit stressed because it sort of keeps us alert, it keeps us challenged, it keeps our brain functioning. If you put someone in a flotation tank with no stimulation, they're literally going to die. And so we want some stimulation in our lives. I think infertility poses a little more than some stress. And so I would say you know yourself better than I or anyone else can know you. And if you are finding yourself, withdrawing from social events, not looking forward to things, having a hard time getting out of bed, crying a lot, have no libido. I mean, if you're just not feeling like yourself, then I think you need to do some of these things. And I'm also a big proponent, and in fact, I was just talking to this reporter today that what can one do for oneself as they're going through this? And we had to give 4 bullets. And I think the first one I said was, I probably shouldn't say because I'll ruin that interview. But one of the ones I said was, I'm a really big believer in, and I know I'm biased because I'm one, but I'm a really big believer in if you're struggling with infertility, maybe it would be a good idea to even have just one session with what we call a reproductive mental health professional. So it's people like me who have specialized training in working with people who are going through infertility or pregnancy loss. And that does not mean somebody who says they're an expert. It actually is someone who is an expert. And one of the easiest ways to find someone is either to ask your infertility doctor, because almost all clinics are associated with some mental health professional or a group of mental health professionals. Excuse me. Or you can go to ASRM, so the American Society of Reproductive Medicine, so ASRM.org, and look under the mental health professional group. And I think there's 703 reproductive mental health professionals in the US, and it goes by state. And even if it's just one session, to have that person make you realize how normal you are and to give you a few coping strategies, or to show you that you and your partner are actually handling this in a healthier way than you had thought, that's okay. But if you think you're too stressed and you're not feeling really healthy, then you probably are too stressed and you need to do something to help yourself feel better.
Thank you. And is it true that certain foods can help boost your fertility?
Not that I've ever heard of. I mean, there's no magic food. And in fact, I think that there are these things like, blue food helps you get pregnant and purple food doesn't help you get pregnant, and pineapples cause fertility, don't cause fertility. And I'll give you 2 examples. So all my patients were talking about how they don't eat pineapple. And I'm sorry, I'll take that back. I went to a seminar at ASRM has this big annual meeting, and they have these round tables, and it was on nutrition and fertility. And so nutrition is something my patients are always asking me about. And so this woman who is a dietitian from the UK was going on and on and on about how infertility patients should not eat pineapple. And people talk about pineapple a lot in this field, and I know pineapple is now a symbol of fertility. But she was saying you can't eat pineapple because it causes miscarriage. And I said, oh. And I thought that was completely ridiculous. And I said, so is the rate of miscarriage highest in Hawaii? And she goes, well, why would you ask that? And I said, Hawaii has the highest consumption of pineapple. So if pineapple causes miscarriage, there'll be a lot of miscarriages in Hawaii. And there obviously are not a lot of miscarriages in Hawaii. So there's no one food. I mean, it's obviously different if you have celiac disease, because if you have celiac disease, which means you can't tolerate gluten, then in fact, eating gluten can in fact decrease your fertility. But the basic idea is to eat good food. Now, the things to avoid, and I actually have done a webinar not that long ago on lifestyle factors, and I think I'm doing another one this year. There are things you should avoid, like, a lot of caffeine, alcohol, smoking, and there's some new data on soda. I don't know, do you call it soda in Texas? Like Coke and Sprite and stuff like that. We call it soda here. That soda is associated with lower fertility rates, and diet soda is associated with even lower fertility rates. So I would say if you're somebody who drinks a lot of soda, you also may want to think about decreasing it. But I have never heard about a food or a group of foods that increases fertility. You just want to eat good food.
Thank you. And does stress and age have any correlation with infertility?
Stress and age?
Age, the age of a patient.
Well, irregardless of stress, age is a factor for both men and women. I mean, I think pretty much everybody knows that fertility decreases with age, certainly more striking in women, but it also decreases in men. I think it's pretty obvious that the older, for example, the woman is, probably the more stressed she is because her prognosis is not as good. And so I'm going to guess that a 40-year-old starting her first IVF cycle might be a whole lot more stressed than the 30-year-old starting her first IVF cycle, because the 40-year-old has probably been told by her physician that her chances are lower than a 30-year-old. That said, you know, I haven't seen a lot of research per se on age. I think though that, I mean, I know I actually I published a study on this and I'm just trying to remember what the results were. Um, I had assumed that we know that women over 40 have the highest levels of stress. And so we assumed that women under 30 would have the lowest levels of stress because a 27-year-old has a great chance of getting pregnant. And we found, we looked at, hundreds and hundreds of patients, is that women under 30 have the same level of stress as women all the way up to through age 39. So being young doesn't make you less stressed. Being over 40 does tend to make you more stressed because you have less time.
And are there any resources that you can recommend to better understand stress and fertility?
It's a really, really dicey subject. It's a very polarizing concept because just like there are a lot of people like me who do believe that stress has an impact on fertility, and there are a lot of people, and I will not name names, who do not believe that stress impacts fertility. And my feeling is, even if stress doesn't impact fertility, we know that people going through infertility are feeling stressed. So what's the harm in learning stress management strategies? Um, I used to have a couple of apps that taught stress management to men and women. Those have now been licensed by somebody and they're not available. Um, there are some good resources on Resolve on how to reduce stress. There's some good resources on ASRM website on how. And I'll tell you, if you happen to be a prelude patient or an inception, whatever we call ourselves, prelude patient, we are about to launch a whole new patient resource. If I could speak, that would help. We're about to launch a whole new patient resources section. And so, for example, I've written a ton of different information sheets on how to cope if you've had a miscarriage, on how to cope during the 2-week wait, how to cope if you've had a positive pregnancy test, how to cope with Mother's Day, how to psych yourself up. So we have a ton of stuff that's going to be launched, I think, within the next month. So if you are a prelude patient, keep your eye out for this new patient resources section, which is going to have a ton of information. There are going to be videos. There's going to be a lot going on. And as I said, at the end of September, we're going to be launching for the first time a yoga for fertility program for our patients, which is going to be a very low cost group program for people to get. One of the things I really like about Hatha yoga is that as we're telling patients not to do vigorous exercise, we can offer them Hatha yoga, which keeps you fit and toned, but it doesn't have a bad impact on your reproductive system. And some research has actually shown that doing yoga might actually increase fertility. So within the next couple months, we're going to be rolling out a ton of great stuff.
Right. Thank you. And I think we have time for just one more question. How can, oh, I just lost it. Sorry. How can couples support each other in managing stress related to infertility?
That is such a good question. I've seen I've seen a lot of couples as they go through infertility. And I think the worst thing one can do is to say, I'm coping the right way and you're coping the wrong way. But you have to learn to respect the fact that you're coping in the best way for you and they are coping in the best way for them. And so you have to respect each person's coping style. Infertility is going to impact both of you differently. in general, in a heterosexual couple, the woman wants to talk about it more. She's more emotional about it. As I said before, men to be more problem solving, they don't tend to want to talk about it as much. I think it's really important, no matter who carries the diagnosis, to approach this as a unit. And even in male factor, where the woman, if it's male factor, the woman has to undergo most of the treatment, maybe have the male partner, deal with the insurance company, make the appointments, pick up the meds, get them as involved as possible. If you can, go for ultrasounds and blood tests. And sort of you're doing this as a unit, as opposed to just her trying to get pregnant. And just respect the way the other person's coping. And, if the other person seems more distressed than you are, ask them what they need. And I can tell you, I've had more patients say to me, my partner just doesn't want to help me. They don't understand what I need. And I'm like, well, what do you need? I'm like, well, I have no idea. I'm like, well, how do you expect your partner to read your mind? So, to know what you need to think about what you need, and you need to tell them. And so one of my patients years ago actually said, and I love this idea, she and her husband, when they were having each a good day, they wrote down 10 things their partner could do for them when they were having a bad day. And so if you're in a bad place and your partner comes in the door, you can say, you know what, I need either 5 or 8. And they'll go to the list of what you need, and they'll give you a hug and go buy you ice cream or whatever it is, whatever 5 and 8 are. You need to be explicit with what you need and what will help you, and communicate that. Don't expect them to read your mind.
Great, thank you so much. Is there anything that you'd like to share before we close out for the night?
I just want you to know that infertility is a challenge. Most people who go through treatment end up with a healthy baby. And, so you can need to stay hopeful, but you also need to understand how challenging it can be, and to avail yourself of every resource you can and every person you can and anything you can do to help yourself feel better. And I wish you all the best of luck.
Okay, thank you so much, Allie. And thank you all for attending this event and for joining us tonight. We hope you found this session helpful. You will receive a a recording of the virtual event that you may view as a refresher at any time.
Thanks so much,
Thank you
Monica.
so
Thanks
much.
for coordinating. Bye, everybody.
Thank you. Bye.